I'm Kyle Ganson. We're going to do some introductions in a few minutes, but I just want to introduce the event here. So we're going to be talking about dietary supplements today, specifically for muscle building and weight loss. And the attention is going to be mostly on hopefully, sharing knowledge to you all about some new research that we've done, as well as an analysis of current policies in Canada that regulate dietary supplements, specifically for muscle building and weight loss, as well as some policy gaps that we see and how we can actually improve those with some changes. So just a quick land acknowledgement. So we want to wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home of many Indigenous people from across Turtle Island, and we are grateful for the opportunity to work on this land. And like we said earlier, please chat and put in the chat where the land you're in if you'd like to, just to acknowledge that space. Just a quick update for disclosures. I mean, because we're going to be talking about different supplements and dietary, supplements and things of that nature. It's just we want to make sure that we are clear that there's no conflicts of interest or anything from the presenters. This is strictly for academic and research purposes. I also just want to acknowledge that the presentation and the policy analysis that Eliana and I have completed was funded by the Richard B. Splain Applied Social Policy and Social Innovation Fund. And so a big part of this fund is to actually disseminate findings to the public, such as events like this. So hopefully you'll learn from this event and bring this back into your own practice, your own work, or whatever you practice in. As I mentioned, this is some just brief objectives. I'm not going to read through these, but hopefully we'll just give you kind of an update of the research on muscle building and weight loss dietary supplements, specifically the use among Canadian adolescents and young adults. We're going to describe the adverse effects associated with use of muscle building supplements and weight loss supplements. We'll describe the actual current regulations, the gaps that are there, and provide some policy recommendations. And here's our agenda. Again, we're going to do some introductions. We'll go through what the supplements are. We'll have multiple points for question and answer, so please put those into the chat, especially as we go along. And then we'll have a longer period of question and answer towards the end. Depending on how many people we have, we may do a little breakout room activity. If not, we'll just do like kind of a reflection activity towards the end. And that will be the end of the presentation. Just as some introduction. So again, I'm Kyle Ganson. I'm just a professor at the Factor-Inwentash Faculty of Social Work at the University of Toronto. My research is predominantly focused on eating disorders, muscle building behaviors, things of that nature among young people in particular. And a lot of the research we'll talk about today has been some of the work that I've done over the number of years. And I'll pass it over to Eliana to introduce herself.
Hi, everyone. I'm Eliana. I'm a second-year Master of Public Policy student at the Monk School of Global Affairs and Public Policy at the University of Toronto. Mostly my research interests are child welfare and public health. So this was a very exciting opportunity for me to work on this project. And
I'll pass it to Ari for Netic's introduction.
Hi everyone, my name is Ari. I use he, him pronouns. I'm the Outreach and Education Coordinator at the National Eating Disorder Information Center. I'm joined here by my colleague Emily, who uses she, her pronouns and is our community engagement facilitator, as well as getting to work as a direct client support worker on our helpline. We are here as a co-host and as support for all of you. So a few notes for technical reasons and hopefully participation. You'll notice that the chat is open to everyone. If you have a message, you're free to put that into the chat, and Emily and I are going to be monitoring it throughout. If you have a technical related concern, please don't hesitate to send a message directly to me in the chat. You'll notice myself among the co-hosts. And if you have a question for one of the set Q&A periods and you want some confidentiality, feel free to message Emily directly in the chat, and you'll notice her among the co-hosts as well. It's a reminder for today that we ask that folks stay on mute and videos off unless you're okay with that potentially being captured in the recording, as this is going to be recorded and posted on YouTube afterwards, as well as some snippets for social media. Live captioning has been enabled. So if you would like captions on, there's a little CC button at the bottom of your Zoom window. And if you're having issues with that, don't hesitate to message in the chat. And the organization that we work for, Netic, is really invested in this topic. We're a registered Canadian charity that have been helping people affected by eating disorders since 1985, and a program of the University Health Network Centre for Mental Health in Toronto, Ontario, Treaty 13 territory, land stewarded by the Mississauga and Anishinaabe peoples and the source of many Wampum Belt covenants, most famously the dish with one spoon between the Anishinaabe, Haudenosaunee, and Huron-Wendat to share and protect the land around the Great Lakes. We help operate a nationwide toll-free telephone helpline, as well as a live web chat service that provides support, information, and referrals to people who are affected by eating disorders and those who care for them. Because you don't need a diagnosis to contact us, it's an anonymous confidential service and anyone can reach out. We have folks all across the spectrum reaching out, including many who are struggling with use around substances, around weight loss products, around the ways in which that's co-occurring with eating disorders or co-occurring with body image issues. And so we're excited to get a chance to have a conversation today on the policy landscape for this. If you have any questions about NEDIC directly, please don't hesitate to direct message Emily or I, and we're happy to chat about it. And you'll get to hear more from us soon. And I will toss this back to Kyle.
Great. Thanks, Ari, for sharing all that. Okay, before we get into the background information, we're going to do a quick little poll. So if you can take a moment just to answer a few of these questions, it just gives us a sense of like who's in the room, how much knowledge is there in the room around these topics, and hopefully we'll be able to fill some of those gaps in your knowledge base. So take a moment, read through these poll questions, share what you'd like, and then we'll hear from everybody. All right, great. I'm gonna end the poll here. A lot of healthcare providers, mental health care providers here, which is really great, which is about more than half of the group here. Most of you have acknowledged that you have some good experience, some knowledge about these supplements. About 75% of you said some knowledge. Some of you, let's see, estimated the percent using whey protein, boys and men using whey protein as 40%. And most of you, almost all of you, said that muscle building weight loss supplements are regulate prescription drugs. So hopefully we'll go through today and some of these will be either clarified or answered for you. And it also just gives us a good sense of who's in the room, like I mentioned. So thank you so much for participating in the poll and sharing that experience. Okay, I'm going to move us forward. So this part of the presentation is mostly just background information to give us some more understanding of, what are these supplements, what are we talking about here? And that will obviously sort of guide us into the policies that we are going to review. So generally, these are kind of underneath these categories of appearance and performance enhancing drugs or substances, which is an acronym as APEDS you might hear. Now, these are a broad category of substances, predominantly aimed at altering appearance and performance, often in an attempt to achieve a specific sociocultural ideal. So most people are using these APEDS in order to change their body in some capacity, in order to fit some sort of physical performance or some sort of image or ideal. Now, these are differentiated by illegal and legal status. So you might know about anabolic androgenic steroids. Now, those are illegal to sell or manufacture in Canada, as well as in the US and many countries around the world. And so you can use them technically, but in order to buy them, you have to get them on the black market. You can't purchase or manufacture them here. Whereas legal substances are like whey protein, creatine, diet pills, amino acids, things of that nature. And today we're going to be talking about the legal substances. So we're not going to be speaking about anabolic steroids in this presentation. So it's just going to be the legal substances. So why do people use these substances? Well, as I mentioned, it's predominantly for the benefits of achieving some sort of sociocultural body ideal. And so typically for girls and young women, that would be like the thin and toned ideal. This is Gigi Hadid, who's like, a very well-known model, this would be like the female ideal, of course. Whereas muscular and lean is the body ideal for many boys and men. And again, this is The Rock or Dwayne Johnson, who, posts lots of images of himself working out and his body on Instagram and social media. And so lots of young people are seeing these images, seeing these bodies, and that, of course, is a major driver of why they might engage in some of these behaviors and substance use. And as I sort of mentioned, so the muscle building products are predominantly going to be for, increasing muscle growth, muscle recovery, things of that nature, much more common among boys and men. And we'll look at some statistics in a few minutes. whereas the weight loss products are much more for weight loss purposes. So those are going to be used a lot more for girls and women. And so we'll go through a few of these again, and this is not an exhaustive list of the different types of muscle building supplements because there's obviously lots of them. But a few of the most common are whey protein, creatine monohydrate, and amino acids. And so whey protein actually aids with the ingestion of sufficient protein for muscle growth. So obviously you're using powders and different protein drinks in order to just increase the amount of grams of protein one can consume in a day, which obviously increases the help with muscle growth. Because if you ate chicken or whatever, like you have to eat a lot of it, right? So it sort of helps with that supplementation. Creatine is a naturally occurring substance actually in our bodies, but obviously you can take it as a powder form. And what that does is it also improves exercise performance and muscle growth. It sort of helps with that, kind of cycle a bit faster. And amino acids come in all different types of forms like pills or powders. This is sort of helps your body repair, helps reduce fatigue or sort of muscle wasting after workouts. And so there's lots of sort of purported benefits in that way. Whereas the weight loss products would be like diet pills, and these are purported to sort of help reduce appetite or increase fat burning capabilities. With diuretics or water pills, this helps rid the body of salt and water, again, sort of to reduce the amount of sort of, maybe appearance of weight that one might have. And probiotics also help, balance good and bad gut bacteria. So again, that can help with digestion and things of that nature. So you can see, again, these are not an exhaustive list, but just to give us some categories of which they might fall into is just an important thing to sort of start with. And so here are some statistics. This is from some data that I collected in 2021. And so for some of you who answered 40%, it's actually 82% of young boys and men who reported using whey protein powders or supplements in the past 12 months at the time of study. So that's a pretty significant percentage of young people who are using supplements, using whey protein. 50% said they use creatine monohydrate. Again, most people start with whey protein and then they move on to creatine. Whey protein is seen as like maybe the first step for many young people who are trying to build muscle mass, young men, whereas creatine is oftentimes the next step. You're probably all familiar with pre-workout drinks and powders. Pre-workouts are sort of a combination of oftentimes creatine, caffeine, amino acids, other supplements in order to sort of use prior to working out, which then of course helps with the sort of energy that one might have to work out and things of that nature. And so we found that 36%, so 1 in 3 had used pre-workout in the past 12 months. And then about, again, 1 in 3 had used amino acids. So a pretty high proportion of young men and boys are using these muscle building supplements, which is, a bit surprising and somewhat concerning in some ways, given some of the data we'll share in a little bit. Now, as far as girls, for comparison, actually 50% of young girls said that they had engaged in whey protein use in the past 12 months. 30% or so, 29% said they used probiotics, and 3% said they use diuretics. So, it's not surprising in some ways that girls are actually using whey protein at pretty high rates as well. While I did say that the predominant body image is that more thin, ideal body image, there's definitely a shift, as we sort of even saw from that image of Gigi Hadid, is to be a bit more toned, a bit more lean, and it's not as like waist thin as we once saw maybe a couple decades ago. It is a bit more of that like fit and toned ideal for young women. So it isn't surprising in some ways that whey protein is quite common among them. Now diuretics, I think, it's a lower percentage, but 3% is actually a fair amount if you think about like how big the population of Canada is, for example. And this is for purposes not related to like, health purposes. So we actually asked people in the survey, were you prescribed this from a doctor or advised by a doctor to use them? So these are people using diuretics for their own purposes. So just some stats to kind of give us some background information on, well, how many people are using it and sort of what's happening here. And this leads us into the question of, is use problematic? Now, of course, there's definitely it runs the gamut of who's using it, how often, what dosage, things of that nature. But a number of studies, many of which I've completed and some of my colleagues have completed, have shown that actually there's lots of, muscle building supplements are associated with lots of, kind of adverse or poor outcomes. So we've shown that it's been connected with problematic alcohol use like binge drinking, criminal offending, intimate partner violence, sexual risk behaviors, actually future use of anabolic steroids. So people who use whey protein or creatine are more likely to use anabolic steroids in the future. Muscle dysmorphia, eating disorders, and even severe medical events such as like emergency room visits, disability, death. And then, of course, not surprisingly, diet pills and laxative use is connected with eating disorders as well. And I should say that some of these studies, actually like the criminal offending study in particular, and the problematic alcohol use study, these were actually longitudinal studies. So we found that people who use these supplements in adolescence at 7 to even 15 years later, they were more likely to engage in some of these behaviors like criminal offending or problematic alcohol use. So this is not just cross-sectional studies where people are experiencing them at maybe one point in time, but instead are actually doing it, sort of leading to this through some sort of mechanism long-term. So we'll pause here. This is sort of our first pause for questions. So if you have any questions, we'll pause for a minute. You can pose those questions in the chat. And we'll see if there's anything we can answer right off the bat. We included probiotics in the list to try and understand all types of supplementation that people might use. So, probiotics are obviously help with digestion, but they could also be helpful with sort of, again, helping people move food through their body quicker than than not using the supplement, for example. And yes, this is a good question. The study is actually Canada-wide. So the sample included people from, it was 16 to 30-year-olds from all 13 provinces and territories in Canada. There was about 2,700 young people who participated in the study. It's a good question. Thank you. Let's see. The question about can they lead to interpersonal violence or because the IPV, the individual seems to use muscle enhancing substances? That's a good question. I think the mechanism is a bit unclear. It could be that people are sort of more likely or more prone to sort of problematic relationships or risk behaviors in relationships, just like they're more likely to use substances as maybe a risky behavior, let's say. It could also be that there's just like social tendencies around like the gym culture or aggression, things of that nature that might overlap into relationships. So understanding the mechanisms of that is definitely something that we need to understand. But that would be my hypothesis at this point. Are these relevant to athletes, especially for creatine use? I think they are relevant to all people. We didn't specify specifically in any of these studies whether they were or weren't an athlete, though we know that athletes are more likely to use these supplements. So it's likely that many of those people who participated in all these studies were in fact athletes as well. Good questions. You're thinking critically, which is good. Also a good question, Jennifer. We didn't ask specifically about vegetarian diets. And vegetarianism within adolescents. So I don't know if I can make a true answer to that question, but I think it is, it is something to think about. But when we posed the question about use of APEDs in our study, it was for the purposes of appearance and related use. So it wasn't for the purposes of, maybe supplementing protein because you're a vegetarian. It was very clear that you would be indicating that you used whey protein or creatine for performance or appearance related purposes. So it could be that they're vegetarian, but it's maybe unlikely that that's a factor really involved. Really good question. See that we have a question being posed right now. I'll pause 1 second and I'll answer this one. This will maybe be our last one. Yes, George, great question. I completely agree. I think masculinity is a big factor here as well. We know that masculinity and muscularity are very, very much intertwined. And so that could also be a mechanism that is possibly underlying some of the criminal offending relationships or alcohol use relationships, interpersonal violence relationships. So certainly driving for muscularity, driving for being more masculine, those could definitely be factors that play a role in some of these sort of co-occurring behaviors, co-occurring aspects of things. And then the last question I'll answer now before we move on is the longitudinal studies about whey protein use in adolescents and adults having a higher incidence of criminal offending applicable to people who start using these supplements in adulthood, such as after 25. Our study didn't look at that specifically, but I would estimate that there's probably still a longitudinal relationship between starting the use of these and then possibly over time leading to criminal offending or other sort of poor outcomes. So we looked at specifically, it was about, I think it was 16 to 22-year-olds use of supplements, and then criminal offending at 7 and 15-year follow-up. So it started pre-25, as your question is asking, but I would assume that there's some connection there as well. These are great questions. I really appreciate you thinking about them and posing them, and we can keep chatting about them as we move on. But that was kind of our background. So now I'm going to hand it over to Eliana, who's going to speak about the kind of current context of Canadian regulation.
Hi, everyone. Yeah, I'm going to provide a quick overview of what the Canadian regulation landscape looks like. So in Canada, natural health products are regulated by the Natural Health Products Regulations, which came into force in 2004, and which is regulated and enabled by the Food and Drugs Act. So per this regulation, a natural health product is defined as a probiotic, an herbal remedy, a vitamin, a mineral, homeopathic medicines, traditional medicines, and things like amino acids are essential fatty acids. So these regulations were created following the growing popularity of dietary supplements among Canadians in the 1990s, which prompted a standing committee on health events investigation in 1997, which then concluded with 53 recommendations, which were codified in these regulations, or many of which were codified in these regulations. So the regulations of natural health products is overseen by the federal government through Health Canada, specifically the Health Products and Food Branch, which includes the Natural and Non-Prescription Health Product Directorate and Marketed Health Product Directorate. So in Canada, products are subject to both pre and post-market regulatory mechanisms, and the Natural and Non-Prescription Health Products Directorate is involved in the pre-market assessments, while the Marketed Health Products Directorate is involved in the post-market evaluations. The Natural Health Products Regulations outline specific manufacturing and site licensing requirements, as well as requirements for labeling, packaging, and adverse reporting. And the accountability mechanisms associated with these requirements is carried out by the directorates I mentioned. So I'm going to go into a bit more detail on the pre and post-market assessments. So natural health products can only be sold and distributed after being issued a product license number, so a natural product number or a homeopathic medicine number by the Natural and Non-Prescription Health Products Directorate. In order to receive a product license number, products undergo a pre-market assessment, which includes providing evidence of health claims and ingredient composition, typically in a monograph and with associated documents. So products are classified by risk and health claim, where low indicates the product is designated for treatment, cure, risk reduction of a minor disease or condition. So for example, alleviating the symptoms of a sore throat through an herbal remedy, and a high risk indicates the treatment, cure, risk reduction, or prevention of a major disease or condition, which is typically overseen by a practitioner, such as diabetes. This is less common for dietary supplements. A monograph, when submitted in an application, is used to prove the safety and efficacy of a product. So product licensees are meant to provide evidence which is linked to the health claim or objective of their product. Typically for natural health products, the ingredients are included in these products are already common to other natural health products and included in the Natural Health Products Ingredients database. So the burden of providing evidence is often minimal. If safety concerns do arise through the interaction of ingredients or dosage claims, further safety assessment is then conducted by the directorate. And evidence for either low or high risk health claims can be provided through citing various scientific studies in the application. Research or clinical trials does not have to be conducted by the product licensee themselves. They are more than free to draw on an existing body of literature. And finally, manufacturers must also obtain a site license by adhering to the good manufacturing practices outlined in the regulations. To obtain site licenses, minimum requirements like sanitary conditions and the like must be met, but attestations for adherence to these requirements can be made by the product applicant themselves, so they don't have to be evaluated by a site inspection or by a third-party authority. And according to the 2021 Independent Auditors Report, since 2004, Health Canada has issued 91,000 product licenses for natural health products. Now we're going to move into the post-market assessments. So once products hit the shelves, the Marketed Health Products Directorate is responsible for the continued safety assessment, compliance with regulations, communication with practitioners, and regulating of advertisements. Health Canada largely relies on a complaints-based process, primarily through adverse reaction reporting by consumers in order to identify non-compliance by product licensees. And then following adverse reporting, the Canada Vigilance Program of the Marketed Health Products Directorate will review this information and determine if further action should be taken. Notably, Health Canada has the power to order a recall if the product poses a risk to Canadians or does not adhere to appropriate legislation or regulations as per the Food and Drugs Act, but Health Canada cannot force a recall. So the burden of responsibility rests with the product licensee. However, the Canadian Food Inspection Agency does investigate whether recalls have been abided by. And then finally, in 2022, natural health products regulations were amended to be implemented in the next 3 years, which will require product licensees to provide further information on the labels, such as allergens and standardized facts tables, and more clearly display associated risks by standardizing the text size, color, and font for greater legibility and education of consumers.
Great, thanks so much, Eliana, for sharing that background. That hopefully gives us some sense of what the current regulation is. It's obviously very complex and nuanced. And so what we're going to do now is actually, I'm going to walk through what the product database looks like, and also the adverse reactions database looks like, just to kind of give you a sense and feel of what kind of information you can find on these products, which is quite, I think, quite interesting and a bit unique. So first, I just chose a whey protein supplement. This is called BioSteel. Whey protein isolates is a pretty common type of whey protein powder that one might purchase in order to, ingest and use maybe after pre-workouts. And so this is actually looking at the product license website. And so on the slides that were distributed to you, you should be able to click the link down here, and that will actually take you to the database. And what you can do is you can just type in like certain keywords. So I had just typed in whey protein isolate, which you can kind of see under the brand name. And so as Eliana was mentioning, this is the natural product number here. So we know that this is kind of how it's been, how it's been marked by Health Canada. You can see that it's active. You can see the different brand names that it's being sold under. You can see the license holder. And you can sort of see kind of the route of administration and dosage form. And so this is the dosage, recommended dose. So again, it'd be like 1 scoop a day, 2 scoops daily maximum. And then there's actually some more information that goes a bit into some of the like recommended use. And so you can see for athletic support, essential for maintaining good health. Now there is some data on potential like risk information. Specifically for children, pregnant women, or breastfeeding women. There is some information around like kidney or liver disease, people who have kidney or liver disease, as well as some potential risk side effects such as like mild gastrointestinal disturbances, things of that nature. So it does give you some information about kind of the risks of use, though again, it doesn't provide as much information as maybe like I previously did about some of these products that might be worth considering for individuals before they use them. And then there's also information on other types of ingredients that are in the products. You can see that 90% of it is whey protein. And then there's also like non-medical ingredients here as well as when the license was initially provided. So if you wanted to, you can explore this database. It is quite, there's a lot of products there. It's quite extensive, obviously, because as we saw, 91,000 or so products have been listed. But you can get, and I should say some products don't have this much information. It kind of depends on the type of product. Like, for example, I was looking at some diet pills as well to share, and some of those didn't have as much, not as much kind of information shared. Some specifically around like what kind of ingredients were included and things of that nature. But it is something that I would encourage taking a look at just for your own curiosities. Now, this is the Canadian Vigilance Adverse Reactions online database. And again, there's a link at the bottom that you should be able to click on the PDF. Hopefully it's active for you. If not, you can probably type it in because it's not too long. And again, I just searched in this database, whey protein isolate. And again, there's just like a long list of adverse reactions. You can sort of set a time frame. I think it goes back to like the early 90s actually. But these were some of the most recent adverse reactions reported. And so again, you can see, when it was initially received, the adverse reaction was initially received, the age of the individual, the gender of the individual, the suspected product brand name. So you can see that some of these are some types of protein, like GNC is like a supplement brand and store. And so you can kind of see what product it actually was. And then, of course, you can see the adverse reaction actually provided here. And so it kind of goes through different symptoms that the person was reporting as they believed it related to, the use of the supplement. So again, pretty interesting. Again, you can go through and comb through. You could search creatine, you could search amino acids, and there's obviously a long list of different supplements that you could search to kind of, suss this out and sort of understand, what's been here. I will say too that this is a very small percentage of the people, right? Because this has to be reported either by the individual or potentially by like a provider, a medical provider, let's say. And so if you might feel, you might take a whey protein supplement or you might take a diet pill or something and feel some sort of side effect. Not all people are going to ultimately or likely, go online and report that adverse event. So, the fact that it goes back only to 2022, there's not that many even in 2022. I think we should be critical of those numbers because it's likely that there's probably more side effects that people are experiencing. They're just not being reported. Okay, so I'm going to send it back to Eliana, who's actually going to compare Canada's policies to some other jurisdictions, just so we can, again, paint the landscape a bit for you all to kind of see where does Canada fall with other sort of North American or sort of, high-income countries, basically. So Eliana, go for it.
Yeah, so in our research, we look to other jurisdictions kind of to search for best practices and to inform our policy recommendations, notably the United States and Australia. So in the US, the Food and Drug Administration, the FDA, regulates dietary supplements through the Dietary Supplement Health and Education Act. But per this act, product manufacturers are not required to submit any pre-market safety or health data to the FDA. And this act does not accord the FDA the ability to approve health claims or labels. However, the FDA can force a recall and reserves the right to remove products from the shelves if the product is misbranded or contaminated or following inspections or complaints from consumers and the product manufacturer refuses to abide by the recall themselves. But as a result of this over-reliance on post-market regulation, state legislators have begun searching for alternative methods of ensuring compliance. So specifically through legislation which restricts the sale of dietary supplements to minors, public health notice, and ingredient-specific restrictions. So of note are the following jurisdictions: New York, Massachusetts, and California, which have all attempted unsuccessfully to pass legislation which would have restricted the sale of dietary supplements to minors, though practices differ slightly across the tabled legislation. So I'm not going to go through the specifics of each legislation because they are quite similar, but notably in New York, this bill did not extend to protein powder or muscle enhancing substances. And in Massachusetts, the bill also included a requirement that retail establishments that sell dietary supplements also display a public health notice of their associated risks, kind of like the public health notices we see discouraging pregnant women from drinking alcohol in restaurant establishments. California is a great example of a state which implements its own regulatory mechanisms outside of FDA market approval processes. And an example of this would be their actions taken regarding ephedrine group alkaloids. So since 2002, California has required products that contain ephedrine group alkaloids to include a clear and conspicuous disclaimer and display associated health risks. And this was 2 years before the FDA banned ephedrine group alkaloids to be included in dietary supplements, even though they are included in other types of medication. And then already prior to 2004, selling dietary supplements, including this product, to minors was already prohibited, and California has since codified this prohibition in their legislation, which is an anomaly in the United States. California also has specific requirements, including spacing and sizing for warning on dietary supplements with stimulant laxative ingredients like senna and rhubarb root. And they're one of the only states that specifically outlines these requirements in their health and safety code regulations. And then we also looked at Australia. So Australia's regulatory system looks a bit more like Canada's. In Australia, natural health products, or what they call therapeutic goods, are regulated by the Therapeutic Goods Act and the Therapeutic Goods Regulations. Like Canada, Australia utilizes a pre- and post-market assessment process, but theirs is risk-based. They also utilize a therapeutic database called the Australian Register of Therapeutic Goods. So as a pre-market process prior to distribution, products must be approved for inclusion among the database and assigned a risk level. So designations of risk are assigned based on health claims and ingredient composition, similar to what we do in Canada. So a low-risk product like a vitamin capable of health enhancement does not require a pre-market approval process and can be sold over the counter as long as all the ingredients included have been pre-approved by the Therapeutic Goods Act. And then a high-risk product such as a prescription medication, which implies the prevention of a serious condition, must undergo a pre-market assessment and include an assertion of quality and efficacy. Low-risk products, they don't have to be regulated for efficacy, only safety and quality. The manufacturers must also obtain a manufacturing license, and they must demonstrate compliance with good manufacturing practices through an on-site inspection. And then they are also subject to random risk-based inspections, even once they've obtained their licensing. And this varies in frequency depending on the product and the manufacturing history. The post-market regulations include pre-approval of advertisements by the Therapeutic Goods Advertising Code and the delegate of the Secretary of the Department of Health. So no advertisements can reference or imply association with a serious disease, and all products are subject to random and targeted surveillance once on the market, with high-risk products at the forefront of evaluated processes. So if you're manufacturing a prescription medication, the frequency of your on-site inspections and the targeted surveillance of your products on the market would occur more frequently than if you were manufacturing a low-risk product, likely like a dietary supplement.
Thank you so much, Eliana, for all that great information. And yeah, like we said, it's important to kind of see how Canada compares to other nations for both getting ideas for how we can improve Canadian policy, but also understand maybe what might be working or might not be working. Okay, so we're going to pause here again, just to see if there's any questions, because some of that is a bit nuanced and can be a little bit dense. And so if there's any questions to clarify around the policies, we'll just pause for a minute or so here. All right, so there's one question, and Eliana, you might be able to answer it more clearly than I can, but in Canada, are the manufacturers of NHPs required to demonstrate that the amount of substance in the product matches the claim on the label? And we will get into this a little bit in a moment, but I wonder, Eliana, do you know if that is required?
Basically, when they submit evidence, they tell the directorate what the amount is. There is no double checking of that information. Most of the evidence seems to suggest that they just have to link the ingredient composition to the objective of the product. However, if they list a dosage claim that is too high, so for example, if it's a pre-approved ingredient, but the dosage they're recommending for an individual to take is like suspiciously high, there might be adverse effects associated with it, then that would undergo a secondary safety assessment. But in reality, there's no checking if it matches the claim on the label. No, they're really the word of the product licensee. Yeah. There's no testing the batches of product.
Yeah, and I think something to underscore too is like, and I think what Eliana is saying is that a lot of this relies on manufacturers to report information to Health Canada without a lot of double checking to ensure that claims are accurate. And not that there's maybe like people being nefarious or anything like that, but obviously it's important to sort of make and double check sort of information that's being provided to protect the health of people. Okay, there's a couple of questions in the chat. Jennifer, I'm actually going to hold your question maybe to the end. So Ari, maybe you can put that one into our document and then we can chat about that one towards the end if that's okay. Just because it's a bit more of a general question. I want to sort of focus just on the policies at the moment. Now, Louise says, how is it that in Canada, some vitamins are sold in doses above the tolerable limit? Do you know that, Eliana?
It's like Kyle said, they're taking the word of the product licensees in a lot of cases and not checking that the doses are accurate to the labels. Or even if the labels are accurate, there's a lot of mislabeling of NHPs that they might be recommending doses at higher amounts than is advisable. And there's no really surveillance once those products hit the market to ensure that this does not occur.
Yeah, that's great. Yes, George, we saw your question and we're happy to chat. You can certainly email us. Muskan, so regarding the policies in New York, could you clarify if the ban is only for minors and if there's any regulation of anabolic androgenic steroids? Yes, in the US, anabolic steroids are federally illegal as well. So again, you can't manufacture them or sell them. That doesn't mean they're not used, obviously, because you can purchase them on the black market. And Eliana, do you know, I'm pretty sure that it is only for minors. Is that correct? Just to confirm.
Yes, it's only for minors.
Yeah, awesome. And also, is there any dose check in any other countries? I would assume, and Eliana, you can confirm with me as well, but I would assume it's a similar process where it's reported from manufacturers without much of a check. Do you think that's pretty accurate?
Yeah, in Australia, though, they do targeted surveillance, so they will pull your product from the shelves, but it is based on a risk assessment process. So as I discussed, low risk products, so things like vitamins and dietary supplements would be categorized as a low risk product. And so they would be subject to less surveillance than any of the high risk products, but they do have a random surveillance check to ensure that there's no mislabeling or misleading dosage.
Yeah, great. Good question. Awesome questions. These are really, really astute. Awesome. Appreciate all the engagement, everybody. Thank you so much. Okay, I think we'll go on. Again, if you have questions that pop up, we'll have one more question and answers time at the end, which will be maybe a little bit longer, just so we can make sure we get to any other lingering questions at the end. But I'm going to move us on to, are the Canadian policies actually working? And again, this is to be sort of emphasized, and I think you're probably understanding from our viewpoint that there are gaps in the current regulations that should be addressed. And I think not number, I don't want to classify them as many of them, but one of them is that they're widely accessible. One of the sort of gaps here is that they're very widely accessible. And so I'd like to sort of pose this experiment to you, which is the next time you go to a pharmacy or even like a grocery store, go to like the health products aisle, go to the pharmacy sort of aisle where there's maybe food products, things of that nature, and just look at the shelves. You'll often find that there's a plethora of types of different, protein powders, creatine, vitamins, amino acids, things of that nature, different types of diet pills. So I would, just take a moment, even pick them up, read them, take a look at them, take a look at the product, like the design on the product. Is it flashy? Who is it trying to capture the attention of? Because I do think that there's some interesting nuances just to how they're presented. So I would encourage you to maybe take a moment to do that. Secondly, we know that they're commonly used, particularly among young people. I mean, again, some of the data that I had reported on was among young people as young as 16 years old. And we know that kids, even as younger than that, are actually using some of these supplements. There's been some data in Canada, specifically among 13 to 14-year-olds who are using, specifically boys who are using protein powders and things of that nature. And that's important just because young people, we know, adolescents, even into their 20s, people in their 20s, they're still sort of having developmental processes, and they may not be able to consider some of the pros and cons or risks and benefits of use. Also, like where they're purchasing it, things of that nature, what kind of substances inside the labels they should be looking for or not looking for. So there's definitely a need for more education for those young people. They may be contaminated with stimulants or steroids. There's actually been a lot of research analyzing the chemical compounds of some of these substances. And that data has shown that they are randomly, again, there's no nuance, there's no sort of explanation of why some and some aren't contaminated, but they have been shown to be contaminated with steroids and stimulants. There's also been mislabeling, so having compounds within the substance that's actually not labeled on the label of the product. So obviously that can be very risky because people should know what they're ingesting. And they're also associated with different regulatory alerts. So like we said, there's these adverse alerts that are happening, but there's also regulatory alerts that that Health Canada does track in some capacity, where they can see that, oh, there is contamination here, or there's different sort of effects that are happening with these different supplements. So are the policies working? I mean, maybe broadly, yes. However, there's lots of gaps here, as we can see here, that put some people, particularly young people, at the highest risk. And so what we're going to do now is actually go through some recommendations that Eliana and I have come up with based on prior research, based on other jurisdictions and what they're doing, based on other policies analyses related to these supplements. And so we kind of broke them down into pre-market recommendations and post-market recommendations, mainly so that we can sort of target how we would propose these to actually make these changes. And I think one thing that I think I'll say at some point, but I'm going to reiterate it here, and maybe Eliana can speak about it a bit at the end as well, is that actually implementing some of these regulations and changes would actually be quite challenging because of the way the law is written. The regulations are on the federal level, so it's harder for individual provinces to actually make these changes on their own, which obviously means that at the higher level, at the federal government, the changes would have to be made, which obviously requires political will and some strong emphasis in that area. So I'll go through these pre-market recommendations, and Eliana will take over the post-market. So pre-market recommendations. So number one is age restrictions. So in theory, actually, the Canadian federal government could place an age restriction on products. They do this for tobacco, cannabis, and alcohol. They should be able to, in theory, do this. Again, whether it's easy or not is a different question, to these different supplements. So, and as you saw from some of the other jurisdictions that we spoke about, there is emphasis or attempts to try and place age restrictions on the supplements. Again, we don't have like the data, but we also kind of make some assumptions that young people actually might lack some of the capacity to make some positive health choices as it relates to use of these supplements. And they're also used most commonly among young people in particular, which again has some worry to it, because we don't actually have a lot of long-term data, let's say over 20, 30 years, that shows what are the long-term health effects that might be associated with them, especially with maybe longer-term use, or using the supplements in inappropriate ways. Like, for example, you might have heard of the phenomenon dry scooping, which is actually taking a pre-workout powder without any liquid. And so you just kind of ingest the powder, which obviously can be very problematic in acute moments because it's got such high caffeine levels. But we don't know how people do that for a year. Maybe they do it a couple dozen times over a year. What does that do to their heart, their lungs, their digestive tract over the long term? Taxation is another pre-market, recommendation that we would probably put in place. Increased costs obviously can deter use, right? If you put a tax on something, it might be really challenging for young people to actually be able to purchase it, in particular. Or people might weigh the pros and cons of, this product is too expensive for me. I'd rather do this, and I'd rather try and increase my proteins and intake by eating more lean meats or something like that. I don't know. So that can definitely be a helpful tool. It's actually, research has shown that actually taxing products like tobacco and alcohol has reduced use among young people. So there is evidence that this might be something that can be helpful. And if we increase funds through taxation, we actually can then fund the research, prevention, intervention efforts to understand what happens long term, to put people into schools, to educate young people, to have some prevention efforts and intervention efforts. Additionally, as we mentioned, like all these products are, not behind the counter. I guess they're like in front of the counter. I don't know if that's the right term, but they're in front of the counter. And so they're easily accessible, right? A young person, anybody can just go and purchase them, go to the self-checkout and walk out the door. And they're obviously, you can purchase them online as well. So that easy accessibility without a lot of interaction with anybody could be problematic. And so if we move these behind the counter where someone has to actually interact with the pharmacist, for example, or even like a store employee, there might be a way to actually provide information about the products through like, a fact sheet or something along those lines, or even just have pharmacists provide some sort of level of counseling to those people to make sure they understand potential risks and benefits of using the supplement. Similarly, we could regulate advertisements. So, something to be thinking about, as I mentioned like before, is looking at the labels. You could certainly go on the websites as well as like the Instagram and social media accounts of some of these supplements, and take a look at like, what are their advertisements? Who are they trying to target with their imagery and their words and text and all that line? So pre-approving and continued monitoring of advertisements might actually ensure that the products are complying with current regulations and policies related to advertising in Canada. And also maybe ensuring that advertisements are accurate, non-coercive, and don't specifically target young people. Again, there's ways in which we can do that so that it's maybe less attractive to young people to use and ensures there's compliance in that way. And our last two for pre-market recommendations would be pre-market testing, right? So right now, there's a lot of reliance on the industry to provide testing to say, okay, these products are safe or they're effective in some capacity. But we would want to take some of that control away from industry because, again, industry in some ways is trying to make a profit. And so we would want to have, Health Canada do some random testings of products, do random testings of manufacturing sites to ensure that products are not contaminated, to ensure that manufacturing sites are safe, they're clean, things of that nature. So that pre-market testing would be a really big one in order to ensure that people are not having any adverse reactions or events. And then also pre-market product notice. So actually providing consumers with the information about new products, again, the pre-market testing results or compliance with current regulations or any safety or efficacy concerns, that may actually reduce use. Right now, there's no real communication, let's say, between, let's say Health Canada and industry and the individual user. As you saw from the database that I showed you, it's a bit technical, like, even I didn't even know about it until I started to do a lot of this research. And so I can imagine that a 16-year-old who's interested in maybe building muscle is probably not going to go to one of those sites to learn more about a product or even maybe be able to understand what the information on the site is sharing. And so creating more transparency, more like, more ability to maybe be more clear about some of these products and their concerns around them is probably very important. So those are our pre-market recommendations. I'm going to pass it over to Eliana now for our post-market recommendations.
Yeah, so as you guys kind of identified, we're very worried about the potential for contamination or misleading dosages of these products, which is why we recommend post-market testing. So presently, no random or targeted post-market testing exists to confirm if product licensees are complying with the regulations, and this poses a risk to consumers. Evidence suggests that natural health products are contaminated and mislabeled. And additionally, we need continued random testing for products and manufacturing sites to prevent issues with contamination, similar to what we've seen in Australia, where they do random surveillance of advertisements, labeling, and on-site inspections. Health Canada also can't force recalls of natural health products or order a change of a label on a natural health product, even if the product presents a serious or imminent risk to consumers. So it is imperative that Health Canada has this authority to both recall a product and force the change in labeling, because putting the responsibility on manufacturers gives them a lot of control and it places consumers at risk. And then we have two final recommendations, which is improved knowledge and awareness of dissemination. So knowledge dissemination. So natural health products should include warning labels similar to that of current public health efforts for tobacco products. So tobacco products have very extreme health warnings and toxic emission statements. And not that it needs to be that bold, but warning labels need to provide information for consumers so that they know the adverse health effects, as well as perhaps knowledge about the lack of regulation or the potential for contamination and mislabeling of these products. It's also worth considering providing a link to an online database of registered products so consumers can check for themselves, or have retail establishments provide information sheets to consumers or display public health notices where they sell dietary supplements. And then finally, improved monitoring of adverse events. So currently the monitoring of adverse events is reliant on individuals and medical professionals. And as we touched upon, this likely leaves a lot of adverse events unreported. So there's also very little data on the effectiveness of such reporting strategies, and it is unclear what happens after the adverse event is reported. So we recommend that funding be allocated to inform and train professionals on how best to screen for natural health product use and provide appropriate guidance to consumers following an adverse event.
Great. Thank you so much for sharing those, Eliana. Okay, so we have about, I don't know, 20-ish or so minutes. I think initially we have these reflection activity questions for us to consider. And so I think what we're going to do is just take a moment to reflect on these and consider the following questions. We'll pause for a few minutes here, and maybe what we can do is have some questions, reflections come into the chat and we can read them out. But something that we really wanted to do with this event is mobilize, obviously share knowledge, and share some information and recommendations, but really mobilize you all to maybe make some steps in your own life, whether it be personal or professional, to maybe advocate for some of these changes, or even make some changes within your own, let's say, mental health practice or healthcare practice, to screen for some of these behaviors or these substances. And so take a moment to think about these questions, and then you can share a little bit in the chat if you'd like. So what new knowledge have you gained from this presentation? So what has been new, surprising, interesting to you? How might you take this new knowledge into your personal and or professional life? Again, a lot of you who shared in the poll said that you're healthcare providers or mental health care providers. This is really relevant in my mind towards healthcare and mental health practices. So what can you take? How can you take this new knowledge to that space? And then also, how might you advocate for policy changes in your own personal or professional life? So again, that might be if you're a healthcare or mental health care provider, for example, how might you advocate for changes about screening? Are you now going to start to advocate for policies within your practice to screen all young people for use of these supplements and substances? Or if you're a person who is just interested in maybe trying to advocate for change on a larger scale, right? Who can you speak to and advocate for that, in these policy recommendation changes? So again, think about these questions. We'll pause for a few minutes for you to reflect. Again, feel free to post some thoughts into the chat. You can also email or message, Emily or Ari directly if you want yours to be a little more private, and we can go from there. You can also pose questions here if you'd like. So that's fine if you're thinking of, as you're reflecting, you're thinking of questions as well, or you have more questions than reflections. That's also okay. Feel free to pose them in the chat or message Emily or Ari. Okay, I'm going to share what Jennifer has said. Reaffirms the thought of the presence of use in youth. It's so high. It reminds me to ask more about it when doing assessments. It seems like, Jennifer, you're a dietitian. I already asked, but could spend a bit more time on it. I do ask, do you use any supplements or vitamins or minerals? Could then go into more advice on usage and caution with them. That's great, Jennifer. Thank you so much for sharing that. I think that's a really good takeaway and really applicable way you can, make some changes in your own practice. Thank you. Another Jennifer says, both of my 20-ish-year-old sons use whey protein and creatine. This discussion has me thinking I need to look at the products a bit more. Yeah, I think that's really an important takeaway as well. I think we should have put the caveat that not all use is going to lead to adverse outcomes. Not all use is going to lead to issues with physical health. There's obviously a sort of bell curve of this where there's maybe some extreme ends where people experience extreme effects. And people, experience no effects, right? And then maybe there's something in the middle, right? But I think as parents, as caregivers, I always encourage people to just ask questions about the supplements and, maybe investigate them a bit on your own, understand a bit more, again, why young people are attempting to use these supplements or using them, for what purposes, what do they know about them, how much are they using, not in an accusatory way, but just in a way to learn and be there to help them in case they need help making decisions about some of these things. So Jennifer, I think that's a great response. Thank you. Peter says the influencer space has been seeing a bit of a shift away from the super thin / shredded ideal towards a healthier amount of body fat, especially for men. So using this data to help when I talk to peers about this stuff is going to be helpful for me. Awesome. That's perfect, Peter. Thanks. Jess says, I have many clients who are using whey protein and other supplements. I will definitely be having more of a conversation about those supplements with them. Awesome. Great, Jess. That's great. Thank you. Yeah, it's really, it's good to hear that you're thinking about how you can, have more conversations. I think that's a really important takeaway from the presentation that I think Eliana and I really wanted, was to be able to just give you new knowledge, give you new understanding about these supplements to again use in your practice or even your personal life, just to have a bit more of an understanding and context here. Shelby says, as someone who works at the Ministry of Mental Health and Addictions, we are constantly working to protect the health and well-being of youth. Ensuring that youth are aware of the dangers and risks associated with using these products, especially from an addictive standpoint, is something I will look further into. Yeah, that's great, Shelby. And there's really not a lot of data on whether or not these are addictive substances. I don't think they are addictive in and of themselves, but I think the effects of them might be partially addicting in relation to, how do they make someone feel? How do they make someone appear in conjunction with things like exercise or, other sort of practices. So definitely something to be considering and thinking about. Knowing about Muscadin says, knowing about policies is really helpful as it helped me understand where the gaps lie. Use the information to think about what I'm buying and also in terms of advocacy. Great. I'm presenting a paper on muscle enhancing substances and use in sexual minorities at a conference in Atlanta 2 weeks later. Yeah, I hope to be part of this policy driven change in the future. Awesome. That's great. Thank you for being a part of this. Advocating is harder, perhaps working with dietitians of Canada or position paper or work with given the practice evidence-based nutrition to put out some specific info on products. That's a great idea, Jennifer. Yeah, maybe advocating within your own colleges, your own sort of organizations to be able to provide information to everybody. I think that's great. This is great. Great ideas. Yeah, you can bring some of this back to your own colleges and regulatory bodies. All right, well, maybe do like another minute or so, and then we'll wrap up with our key takeaways. And then again, we'll have, probably 10 to 15-ish minutes of questions. And again, if you have questions, you can pose more of them in the chat at this time, and we will sift through them as best we can at the end. And yes, Eliana and I actually created a very nice visual policy brief that kind of synthesizes a lot of this information. And again, you can use that either in your own personal practice or if your own advocacy, and we'll share that with you at the end. Oh no, Ari just dropped it in now. Perfect, thank you. So you can also download that and take a look at it. And that can also just synthesizes a bit of this information as well. Okay, I think we'll move on. Thank you so much for just reflecting, even if you didn't share. Hopefully you did do a little bit of reflecting and thinking a bit about how this new knowledge might have been helpful for you. Okay, so here are just some key takeaways. Again, as you're listening, you can certainly pose more questions. So key takeaways: muscle building and weight loss supplements are widely accessible and they're commonly used among Canadian young people. Hopefully that point has been driven across to you all, so you can sort of understand that context. Use is not without potential consequence. So we know that there's some health effects that are associated with use. We know that there's some social effects that are associated with use. And so we need to understand that and take that into consideration when thinking about these supplements, recommending them, and just understanding them in the context of use among young people. Current regulations in Canada, while they are stronger than those in the US, there are certainly gaps, as we went over, that do put Canadians at risk, again, particularly young people who may not have the capacity or knowledge or ability to really understand the nuances of use, as well as the ingredients that are in them. And as we went over, pre and post-market changes would significantly increase safety, reduce use, and decrease adverse events. So if we implemented some or all of those recommendations that we posed, there likely would be changes in use and hopefully increases in safety and therefore decreased adverse events. And as we mentioned, I think Eliana mentioned it during part of her segment, that there was an independent auditor who actually reviewed NHPs and kind of assessed the policy. And so there is some political will to do something, to maybe make some changes. And I think that's a really good point to kind of land on and end with, because it sort of emphasizes that there is an effort or there is a sort of desire in some capacity to potentially make some changes. And if the argument is strong, and if the recommendations are clear, and if the people sort of speak their mind and make their viewpoint heard, it's likely that there will be policy changes that can maybe, again, help people in Canada, specifically young people, to avoid some of the harms of use. So those are our key takeaways. Hopefully that was clear to you as you were going through the presentation, but certainly you can sort of land on this as the big key takeaways. And so we'll pause here again for some questions and hear what you have to say if there's any other lingering questions for you all. And I know there was a few questions that were already posed. Let's see. The first one that I think we saw in the chat was how do socioeconomic factors impact risk associated with youth who use these products? I think that's a really good question. Some of our research has shown that there are differences across socioeconomic factors such as like race, ethnicity, or even education with engagement with the use of different dietary supplements. I'm not recalling exact data off the top of my head, but I can certainly, if you would like to email me, my contact information is on the next slide, which I'll share at the end. But you can certainly email me. I'll share with you some of the PDF papers that we've written that have looked at some of those socioeconomic differences around use. And a lot of that should be highlighted too, because there might be certain stressors among certain groups to adhere to specific body ideals. That people feel potentially more stress related to not fitting in with that ideal. Therefore, they strive harder for the ideal itself. So they might go to more extreme levels in order to achieve that ideal, such as using some of these supplements or even anabolic steroids, for example. Another question, since influencers often promote these products, especially international influencers, how effective can control of ad environment be? It's a great question. I would say let's regulate the ads and then do some testing and evaluation of what happens whether we do that. Is there a decreased use, etc. But that maybe there's some emphasis and desire and need for countries to come together to start to regulate them. And I will put a little plug out there that actually Eliana and I have worked on a separate policy analysis that we're hoping to get published soon. It's been under review at a couple journals, but it is looking at actually the policies of social media companies as it relates to these products. So there's been lots of policy analyses of weight loss and diet related content on and advertising on these different social media companies. But there hasn't been any real data and analysis of what do the policies say about muscle building supplements and specifically like steroids, for example. And so what are the policies say about that? And what we can tell you, sort of anecdotally, is that they're not super great. That there's not a lot of regulation, if any, on whether or not different companies allow the content and advertising of these different products. So it's definitely out there for sure, and is certainly impacting young people. Another question, how does third-party testing impact the validity of these products and their claims or contents? Well, I think having another set of eyes would be, I think, really important. If it's just relying on industry to be able to provide the data, there might be less rigorous study. There might be loopholes that are sort of, put in place, or again, there might just be errors in the research process. That does happen. And so having a third party, having an independent sort of, Health Canada, for example, or having someone else sort of review the research or conduct their own studies, hopefully would just add another layer of validity and efficacy and safety to the findings. And then lastly, is there a way to report a dose that is unsafe of a vitamin? That's a good question. I don't know. I think that, I don't know, Eliana, do you have an answer to that? I'm not an expert in vitamins, but yeah, I don't know, Eliana, do you have a thought?
Not specifically in, I think, the pathway you're referring to, but you can report marketing complaints to Health Canada for natural health products, and it does include like misleading labeling. So I think it would fall under that umbrella, and then they would review it in a similar pathway that they would if you reported an adverse event.
And I should say that I think vitamins, while they are relevant, there are natural health products. They're slightly different than I think like a multivitamin, for example, is probably the lowest on the risk scale. Whereas obviously you can sort of go up the risk scale with different muscle building and weight loss products. So yeah, and some of the data that I actually shared to you, the data that referenced use of these muscle building supplements is associated with like adverse medical events like disability, ER visit, death, things of that nature, actually compared to vitamin use. So comparing to vitamin use as a baseline, these products are actually much more unsafe than vitamin use and have more adverse reactions and events associated with them. So in that way, vitamins are seen like multivitamins, for example, and maybe like a vitamin D vitamin, for example, might be lower on the risk scale than some of these other products. Is there any evidence connecting the usage of APEDs with aggressive behavior? If yes, what is one of the recommendations you would give? I think there is, whether it's directly correlated, but I think there isn't actual data that I know of that actually looks at aggression in and of itself. But it looks like we've shown data, like I mentioned, about inter-event partner violence. So certainly, that is obviously an aggressive sort of behavior. Jennifer, APEDs are appearance and performance enhancing drugs and substances. So that's kind of maybe a big umbrella term for muscle building and dietary supplements. So Muskan, to answer your question, I don't know of any specifically. That being said, for steroid use, there has been a fair amount of studies that have looked at steroid use as it relates to aggression. But again, that's not what we were speaking about today, because steroids are obviously illicit and illegal to purchase. So yeah, there's a little bit of a nuanced difference there. But I think behaviorally, we can see that there might be links between APEDs use and aggression based on behaviors people engage in. I'll keep the question. You can keep the questions coming if you want. I'm just going to put our last slide here just so you have it. You certainly can message me, email me if you have any questions. You can message Eliana as well. I try to post a lot of my research on Twitter and Instagram as infographics and things of that nature. So feel free to follow along if you're interested in this kind of topic. I'll also put a plug in there that Eliana is graduating this year. And so her LinkedIn is here. So if you know of anybody in the policy space who might, be interested, feel free to connect. And then, of course, NEDIC's website is down here as well. We want to really thank NEDIC for, for co-sponsoring this and sharing all this time. And Ari just put in a little feedback form. It's quite short. If you don't mind, we'd really appreciate you taking a minute or two to complete it. You can do that now. It'd be really great just to kind of get a sense of, the feedback you have about this, how we can improve it, any information that you might want additionally, and just what you might have learned from the presentation. Yes, Jennifer, I would agree. It would be nice to see Health Canada put out upper limits publicly and widely. Yes. Yeah, providing more information on those dosage would be really helpful. Yes, as we agree, right? Even taking too much of a vitamin is obviously problematic as well, for sure. Is there any research on the kinds of diet/muscle gain culture /memes on social media, like the content and how much it is impacting youth and young adults? That's a very good question. Well, we know that there's lots of research on, the impacts of Instagram on female body image and female eating disorder related behaviors. There is not a lot about social media as it relates specifically to muscle gain culture. We have actually recently published a study looking at social media and media use at large and muscle dysmorphia symptoms. And what we did find was that young men in particular who spent more time on social media were more likely to have symptoms or greater symptoms of muscle dysmorphia. So there's something there. We do have a paper that's unpublished at the moment, so I can speak about it more anecdotally, but we did look at social media and screen use as it relates to, again, this muscle building supplement use. And again, we found some connections there as well, but that's still under review at one of the journals that we have. So definitely, there's definitely impacts there that need to be teased out and understood a bit more. And some of that is things that I'll be doing in the future, I'm sure. Great questions.
Just in case, while any final questions come in, we'll just say that the recording of this is going to be edited and then posted. And then once it's posted, you can find it on the NEDIC YouTube channel, as well as through the folks who registered on Eventbrite to get this link. We'll send out an email with the recording there, so you can have it. The slides for this session that Kyle and Eliana have been sharing were shared in your pre-webinar email, and I'll also repost that in the chat right after I finish speaking too, for folks to take away. Ditto that infographic that you can find in the chat and download, as that I think might be helpful if you were planning on emailing, sharing the findings more widely in a more accessible manner.
Yeah, you can feel free to stay on as long as you'd like. I think we can kind of wrap things up now. It seems like there aren't a lot of questions coming in, so Ari will post those things for you in the chat. Again, feel free to message me or Eliana or connect with Nedic as well if you have any follow-up questions, and we're happy to chat more about this. And again, please, if you don't mind, take a moment or two to complete that event evaluation, the anonymous feedback form, just to give us some comments and feedback about how you think this went. It's obviously very informative and helpful for us. Shelby, thanks so much. If you have any follow-up questions about how you're making some of these provincial changes, please let us know. All right, thank you, everybody.